ஸோ இங்கே டிஸ்கஸ் பண்ணுறது புத்தி கிளினிக்கில் வந்து ஒருங்கிணைந்த மனநல மருத்துவம். இதை வந்து நாங்கள் ஒரு நேஷ்னல் ஒர்க் ஷாப் லெவலில் டிஸ்கஸ் பண்ணிட்டு இருக்கோம். நிம்மான்ஸ்லேருந்து பிஜிஐ சண்டிகர் இந்த மாதிரி இடத்துலேருந்தெல்லாம் வந்து எக்ஸ்பர்ட்ஸ் நிறைய பேர் வந்திருக்காங்க. ஆல் இண்டியா இன்ஸ்டிடியூட் எல்லாம் வந்திருக்காங்க. இப்போ
the privilege of taking you through this afternoon. For 2 days, this room held a conversation that does not happen often enough. Clinicians from Ayurveda, from yoga, from technology, sitting at the same table rather than in candid rooms. Before we come to we would like to honor the people who made it Gadar, chairperson of the National Medical Commission. Department of Integrative Medicine at the National Institute of Science, Bangalore. The Professor of Psychiatric Social Work in Psychiatry and Neuroscience, Bangalore. May I call upon Dr. Rama, Chief Clinical Officer, to do the in charge of CCRY, Center for Mind Body Intervention to Yoga at the Postgraduate Institute of Medical Education and Research, Chandigarh. The Head of Department of Integrative Medicine. Thank you. Over the 2 days, some of India's senior voices in psychiatry, neuroscience, Ayurveda and yoga research have been in one room, working through one important question. Good together in 6 presentations.
Good afternoon to all of you. Apologies I have to use. We from different specialities have met yesterday and today and have deliberated several issues related to integrative health approach in psychiatric conditions and mental health in general. There are 4 or 5 points I think I'll make it as. Number 1, there is no health. This is what the WHO says. Millennia ago, Ayurveda as a science also said that body, mind and soul should be healthy. So we believe in that holistic healthcare tradition then and even now. That being the case, mental health gets priority. This is number 1. Number 2, mental health, when we talk, there are 2 components. Being healthy and fit mentally and getting illness and getting out of the illness. For a long period, the health department focused on mental illness and treating them. And today we have woken up to the fact treating and getting the mental illness better is one step, better health is the second step, and the third step, healthy individuals promoting better resilience and wellness to be fit enough to withstand the wear and tear of the stresses that we get exposed. We discussed that also. Illness, there is a huge mental illness burden in the society. People don't recognize that they are approach appropriate resources to get themselves better. People may have on their own some skills to get themselves better. They could have their own family member counseling them. There could be a priest in the village that counsels him, or a grandfather or an uncle who will counsel them. But mind you, these have had their own challenges with nuclear families, urbanization and so on. So mental illness, when it comes up, prompt treatment is required, and the government has done several things, which includes the National Mental Health Program, the District Mental Health Program, and more recently the Tele-Manas, which is a telephone-based national health program. Perhaps the Tele-Manas is the first of its kind in the world, which has used technology for a public health transformation in mental health. This is one part of it. The second part of it is, all along, apart from what we use in modern medicine, all along mental health has received attention from the traditional systems, Ayurveda, Yoga, Siddha in this part of the country. They all applied their mind to get mental illness better. In fact, the entire Yoga Shastra focuses on strengthening your, of course, for a spiritual purpose, but in the process your mind becomes fairly strong and resilient without succumbing to the stresses leading to mental illness. This is fourth point. The fifth point is, there is a lot of research in the recent years conducted, including modern medical departments, on use of traditional inputs like Ayurveda, Siddha and Yoga in the care of mentally ill, which has demonstrated that there can be additional benefits that will occur. And also it is true that even the traditional medicines can themselves be effective in many people with mental disorders. These as lifestyle practices can enhance the mental well-being.
These kind of yoga protocols. As we do this kind of service at TGI Chandigarh, we also collect data of what is happening to these patients who are already on medication. So for a patient of migraine who is already taking some beta blockers or some drug, anti-migraine drug, what happens if you give a yoga protocol for migraine? And we have reported that it improves the symptoms, it reduces the frequency and the duration of the headache. Similarly, such studies are going on many untreatable diseases that we discussed today. And we discussed in this particular 2-day workshop of how we should maneuver and strategize research programs and research experiments such that we can compare modern medicine and modern medicine plus yoga.